if you're in a traumatic state, go on pharmaceutical drugs. But like you said, give yourself a time where you're going to be able to cope with it, and then do something about it, and then heal, right? Yeah. That's the big crutch with it.
In classical herbal medicine, the very first book of Chinese herbal medicine is called Shen Nong's Materia Medica. Shen Nong's a historical figure, an imaginary figure who ate the plant medicines, looked inside of his stomach, saw what it was doing, and then compiled a book about here is how medicine works. And he divided medicines into 3 categories: lower, middle, and upper grade. And lower grade medicines were the things that were used in lower dosages for shorter amount of times, because if you at a higher dosage or a longer time, they would become toxic. Mm-hmm. They were meant to treat disease acutely when you needed a big gun.
Yeah.
But you couldn't use that big gun forever because it would become poison.
Mm-hmm.
The middle grade herbs would be the ones to help you rehabilitate. You're not needing the lower grade anymore, but you're not fully better. The system is still not operating smoothly. We need to prime the functioning of the system rather than treating the disease. And then the upper grade ones were the longevity, the telomere enhancing, the ones that if you took them for 20 years, you just lived because you were just doing it as a cultivation to support your health rather than doing it because you felt like you were ill and you needed to do this so that you wouldn't die. And I think that's a model that is really a great way to look at medicine, is like there is a time and place for big gun, powerful, and possibly toxic intervention.
Mm-hmm.
Just absolutely a place that saves lives.
And to me, that just makes sense, right? When you say it like that, it's like, oh yeah, there is a place. It's not like you're saying, no, get rid of all of it and let's never see that or use it again. There's a place for it, but let's be reasonable with it. Let's see it, for what it is, and look at these, as you put it, the 3 different types of approaches we could go with, and really do this for the betterment of all of us.
And I think, like, if you look at any one of your patients, you can drop them into any one of those 3 phases, right? Usually patients come to us and they're in more of the acute disease state, and we try to move them into a rehabilitory state. And then we eventually get them to taking care of themselves, where they don't need to see us, but maybe they check in and get a little tune-up here or there with the seasons or once a year or whatever. But it's not, like, patients are not meant to stay in that sick disease state.
They're not meant to, but they are in the conventional model, right? You're just managing their symptom. You're not getting them to self-manage, which is what you're talking about getting people back into. Once you can start doing that yourself and you don't need those acute type medication, you're out of that state already. You're in a state to take care of yourself. You're in a state where you're self-healing again, what the body should be doing. Sure, it was out of place and you needed some assistance for that time. But just like you break a bone, you're not going to wear a cast for the rest of your life. You wear it during that acute period where it's really healing, and then you do the rehab, and then you do all the things, and you slowly build it back up. So it's like, you see that everywhere with cuts. It's so funny because when we can visually see it, we get it. When we can't see a disease literally attacking and, every day monitor it with our eyes, it's like, well, no, of course you need drugs for that. So it just boggles my mind sometimes that people see healing in other aspects, like a cut, a broken bone, anything, and then don't apply that to chronic disease.
Yeah, I totally agree. And that concept we would say is the micro-macro. The micro is the broken bone. The micro is the cut. The macro is there's certain phases to healing no matter what. It's a broken bone. And what those micros look like will be different in the speciality.
Yeah.
But it's still, like, the human body is the human body. Whether we call it Chinese medicine, we call it Western medicine, like, it's still the same package of bones and nerves and flesh and vessels and bioelectric energy or chi or whatever you want to call it. It's still...
Yeah, so many words there for that, right? Chi, all these others.